If you know about anyone or you hear anybody talking about suicide, make sure you get help for them as soon as possible. I'll start.
That was loud. Yeah.
But I promise you, it's doable. I don't know what I'm doing.
Oh no.
My prayers are with you. My thoughts are with you. My name is Dr. Rola, clinical psychologist, and today I want to talk to you about uncovering the truth about suicide. Suicide is one of the leading causes of death in the United States and the world. That's why it is important for us to dispel some of the myths about suicide and expose the truth. We want to make sure that we're better able to recognize the warning signs of suicide and respond appropriately when people are in trouble. I'm going to share some of those myths with you. Myth number 1 is that a person who talks about suicide has no intention of doing it. This is a commonly held belief, but is untrue. Actually, many people who are thinking about suicide talk about it because they're crying for help. Many are afraid about their thoughts and they're looking for somebody to recognize that they're in a very difficult place. One of the warning signs of suicide is that a person actually talks about it. They can hint about not being here in the future. They can talk about not wanting to wake up in the morning. Or they can say things about dying or death. All those are signs that the person is closer to attempting suicide than farther away. Myth number 2 is that alcohol and substance abuse does not have anything to do with suicide. This is untrue. Many people will begin to abuse substances or increase their use of substances when they're feeling depressed and when they're feeling suicidal. They're almost beginning to wish that they would abuse the alcohol or the substance enough to a point where they will harm themselves or end their lives. Many of the people who die of accidental overdoses are actually people that were thinking about suicide. Because what alcohol and substance abuse does is it increases impulsivity. It clouds a person's judgment and makes them to make decisions that could lead them to harm themselves in the end. Myth number 4 is that a person's risk of suicide is over if there is a sudden and huge improvement in their mental state. This is a commonly held belief, but it's not necessarily true. Sometimes people who are depressed and thinking about suicide actually look better and act better because they've already decided that they're going to attempt suicide. And because they've made up their mind that they're going to attempt suicide, that becomes something that motivates them as a way out of the suffering that they're going through emotionally. The risk of suicide is not over just because there's an improvement. A person who is not at risk of suicide this morning could be at risk of suicide tonight. Myth number 5. Myth number 5 is that suicide attempts and completions often happen without warning. This again is a commonly held belief, but it is not true. In over 80% of suicide, there were actually warning signs. It's just unfortunate that we missed it. Family, friends, teachers, relatives often miss these signs again because of misinformation. So how do you take action? How do you help somebody who is feeling suicidal? Again, the first thing you need to do is ask. Ask in a calm manner, with as little emotion as possible, and ask directly. Are you having thoughts of harming yourself? Are you having thoughts of giving up on life? Are you thinking about death or dying? Ask directly. Be as calm as possible and listen to their response. Try not to show as much emotion if you hear something that scares you, because you want to show an appearance of calmness that will give the person confidence that you can handle what you're hearing. Assure that person that there is help for them and that these feelings of suicide and these feelings of hopelessness is not going to last forever. While you're waiting for help, you want to make sure that you provide constant supervision. Make sure you keep away from the person any means that they could use to harm themselves, such as alcohol, substances, bed sheets, ropes, anything, guns, knives, anything that they can use to harm themselves. You want to make sure you keep them in a safe place while you await help. Now, what kind of help could you reach out for? You could call the police if it's available in your area. You could call the ambulance. You could reach out to a mental health professional. In some communities, there's limited resources. They may be calling for a spiritual advisor. They may be calling for extended family. Get as much help that is available in your community, in your area, to let this person who is struggling with suicide know that you are there for them, that you care about them, and that you want to help them to explore other options rather than exploring suicide as an option. I want you to share this video because we need to get the truth about suicide to as many people as possible. If you haven't subscribed already, please do so, and let's keep this conversation going.
Thanks for tuning in to another episode of Balancing Life with Dr. Rola. Be sure to give us a thumbs up and share this video. Let us know your thoughts by leaving a comment down below and be sure to subscribe. Also, Dr. Rola would love to hear from you. Visit us at AskDrRola.com. This episode was shot and produced by Simeon Fabumi, with editing done by Kemi Fadarin.